All right, so our patient right now actually has some back pain. He's a small guy, so he's never been in the gym before. He's been compressing the back, doing a lot of lifting, and in particular, he talks about having pain while he's just with prolonged standing. In particular, though, we found a functional movement that created some more pain by just simply side flexing, and he felt that it generated the pain onto that side. So we're just gonna have our patient side flex over, and he's going, ouch, that's where his pain is. Now, what we're looking for now is how can we reduce that pain? In particular with him, we've already done a little bit of an assessment with his SI joint, and we noticed that there was a bit of a rotation that was going on. So what I'm going to do is a standing force closure on the patient, and what we're going to do is see if that force closure makes him feel better when he goes back into the side flexion. So basically what I'm going to do is I'm going to have him step out just a little bit. I'm going to grab his pelvis. So with my one hand, I'm getting right at the SIS. With the other hand, I'm going to the PSIS, and what I'm going to be doing is almost like a protractor, pushing up in this kind of an arced direction. So I'm just going to grab that, do my manual force closure, and have him reproduce that right side flexion again. And is it better or worse? No change?
It's better.
Okay, so what we're looking for is that he gets either decreased pain in the force closure, or his range of motion improves drastically before the pain actually comes on. And in his case, we had that reduced pain. So the tape job for this is relatively simple. We're going to have him just face the table, and he can use his hands there just to create some kind of stability for himself. We're going to use our taping now in order to reproduce what we did with our hands. So in this side, what we're going to do is we're going to try and pull that pelvis anteriorly. On this side, we're going to try and pull that pelvis posteriorly. Now, in the reality, we're not pulling or mechanically changing anything. All we're doing is creating a neurologic reset that tells the body to change the position of that joint. So we're going to measure from sacrum, basically just to the lateral lumbar fascia, and we're going to cut 2 of those strips. Once again, when we're rounding the corners, rather than wasting time, we can just fold things over and create 2 rounded corners with 1 cut. So with the kinesiology tape, we're going to use this as our under tape. Now we can do this in progression levels. So the first one, we can literally just take our finger, put it on that skin, and try and pull the tape over. But you might notice that there's not a big amount of skin pull. You can see a little bit of a fascial pull that's going here, but it might not be enough to actually resolve the patient's symptoms. With the second one, we're going to come from the lateral lumbar because we're going to do that same type of a pull. Each of these tapes are done on the pelvic, along the pelvic crest. Pull that skin over, lay it down, and then what I like to do is overlap the tape so that we help cover up edges. Now, this is step 1 and a progression level. So we can have him do his side flexion from there and check to see if it's better, worse, no change. I'm looking for a 50% reduction in his symptoms. So if he doesn't get a 50%, we're going to go to the next progression level. So go ahead and do your side flexion again.
Give it a good test. It's a little bit, but not.
It's only a few percentage points better. So we're going to have him lean over one more time. Now in this case, we're going to bring out our strapping tape. This is one of the most important things with taping, especially using certain techniques. We're going to use a tab taping. This is Tim Brown's SPRT taping technique. And we're going to use that tab to create the same vector pull. We're going to put our finger about a 1/4 inch to a 1/2 inch in front of that tab, push into the skin. And now you can see how much we're actually creating a convolution there. We're going to do the same thing on the opposite side with the tab, except our vector pull is going to be towards the sacrum. Once again. And now we're going to have the patient do his side flexion again. And that's the great thing. Now, the kinesiology tape is a very, very important part of this, but you notice the progression levels. We can go from something as simple as just a fascial pull with the kinesiology tape to, as I like to say, using something like the strapping tape, the SPRT tabs, which is like putting kinesiology tape on steroids. So it gives a much greater neurologic stimulation, which is what he needed in order to get to an asymptomatic state.